Picture this, a quiet doctor's office after months and months of tests. Or maybe it's a chaotic hospital room right after a sudden, scary fall. Or, honestly, maybe it's just you, sitting all alone late at night at your kitchen table, staring down a mountain of incredibly confusing medical papers. If you've tuned into this explainer, you might be right there in that deeply overwhelming, totally isolating moment, trying to make sense of a parent's brand new dementia diagnosis.
The source material we're digging into today captures this exact feeling perfectly. It says, "You have never had to think about this before, and now you do." It hits hard, right? Your parent, the person who is probably always your rock, is now the one you have to care for. So let's just take a collective deep breath here. You are definitely not the first person to sit at this table. And I want you to know, for sure, there is a clear path forward. Think of this explainer as your personal roadmap for taking those very first, absolutely crucial steps out of the chaos.
So welcome to the explainer. Today we're unpacking when dementia comes home, the first steps for California families. Our goal right now is simple but super powerful. We are going to transition from that state of paralyzing shock into a place of empowered readiness. Now, I know the healthcare and legal systems here in California are, well, they're complex. It's a maze, but don't worry, because together we're going to figure out exactly how to navigate the whole shebang.
To do that, we're breaking this massive mountain of caregiving down into 5 highly manageable zones. We'll start with understanding the diagnosis, then move to legal and medical teams, creating a safe home, California care programs, and finally, support and immediate action.
All right, let's dive right into Zone 1, understanding the diagnosis, or as I like to think of it, finding your "you are here" marker.
We really need to pinpoint your "you are here" marker on this map. I mean, what does this diagnosis actually mean for your parent and your family? Well, dementia isn't actually a specific disease. It's more of an umbrella term for a decline in mental ability that's severe enough to interfere with daily life. Alzheimer's is the most common type under that umbrella, but there are definitely others. But here's a fascinating perspective from our source material. For right now, the specific type matters a lot less than the diagnosis itself. We really need to reframe this. The diagnosis is not a tragedy, it's a vital tool. It literally gives a name to the forgetfulness and those personality changes you've been seeing. And you can't fight an enemy you can't name, right? This diagnosis means their brain is changing, yes, but their essence? That is still there. It just means it's time to plan.
Moving on to Zone 2, legal and medical teams, the triumvirate of care.
Okay, so we have an urgent need to get the medical, legal, and family roles organized right now. Let's look at the medical and family sides first. You, as the adult child, are most likely going to have to step up as the central manager of this team. It's time to build a central binder or, a dedicated computer folder if you're more tech-savvy for the primary doctor, the neurologist, and the geriatrician. You've got to track the appointments, the test results, the medications, all of it. But listen to me, you cannot do this alone. You absolutely must hold a family meeting. And yes, I totally know family meetings can be super tense, but it's where you have to assign primary caregiver roles. Who's handling the finances? Who's driving to appointments? You have to be completely honest about your limits here. Caregiving is a marathon, not a sprint, and unspoken expectations are just a fast track to burnout and resentment.
Now, I want to talk about a number that is perhaps the absolute most important thing you'll take away from this entire explainer. That number is 2. There are exactly 2 critical legal documents that you must secure immediately. And you have to do this while your parent still has what the law calls legal capacity to make their own decisions. Because honestly, once that cognitive window closes, everything becomes infinitely harder. So what are they? Document 1 is the Advanced Healthcare Directive. In California, this names an agent to make all medical decisions if your parent is unconscious or just unable to communicate. And a quick note here, it's not just for end-of-life scenarios. It's literally for any situation where they can't speak for themselves. Document 2 is the Durable Power of Attorney for Finances. This one names a person to manage bank accounts, pay the bills, handle property, all that fun stuff. Securing these 2 documents right now is a profound gift to your family. If you don't have them in place, you risk having to go to court and petition for a conservatorship. And our source notes that is a long, highly public, and incredibly expensive process. You really want to keep that control within your family. All right, let's shift gears to Zone 3, creating a safe home. Time to start fortifying the environment. We really need to look at your parents' home differently now. A place that used to be pure comfort is now, frankly, a landscape of potential hazards. But don't panic. We're talking about a thoughtful assessment here, not some massive, expensive renovation. Step 1, look at the general areas. Get rid of all those throw rugs immediately. They are major tripping hazards. Just roll them up and put them away. Also, add nightlights to all the hallways. Step 2, the kitchen. Someone with dementia might easily forget they left the stove on, so look into automatic shutoff devices. And Step 3, the bathroom. This one is absolutely critical. Install grab bars in the shower and right next to the toilet, and make 100% sure you have non-slip mats in there. These are simple, relatively cheap fixes, but they can prevent catastrophic falls and fires.
Now, this physical safety extends directly into daily management too. For instance, medication management, that is non-negotiable. Your parent might forget to take their meds, or even more dangerously, take them multiple times. So lock up all the medications, use a pill organizer, and frankly, you just need to prepare to take over the dispensing responsibility completely. Then, there's the terrifying reality of wandering. A person with dementia might literally walk out the front door with a purpose, but then become completely disoriented. So get them a medical alert bracelet with your contact info on it, install some simple door chimes that'll just give you a little alert when a door opens, and very importantly, let your trusted neighbors know about the diagnosis so they can keep a friendly eye out. And finally in this section, we have to talk about the elephant in the room, driving. This might just be the most agonizing conversation you are going to have because taking away the car keys feels exactly like taking away their freedom. But a person with dementia simply cannot drive safely. The brilliant advice from our source on this is to reframe it. Frame this as a medical decision, not your own personal command. Talk to their doctor. In California, doctors are actually legally required to report unsafe drivers to the DMV, so let the doctor be the bad guy. Honestly, they're used to it and it preserves your relationship with your parent. Yes, it is a profound loss for them and you absolutely must acknowledge that grief, but safety has to come first.
Okay, moving into Zone 4, California Care Programs. Let's talk about navigating the system.
The cost of care is a massive, massive source of anxiety. You're probably looking at your parents' savings right now and realizing, wow, this is going to run out. And that feeling is completely valid. But California actually has programs designed to help. In fact, here's a huge misconception that completely surprised me when reading the source material: the difference between Medicare and Medi-Cal. So Medicare is federal insurance for folks over 65. It's great for doctors, hospitals, maybe some short-term skilled nursing. But it does not cover long-term custodial care. Custodial care means help with daily living, things like bathing and dressing. Medi-Cal, on the other hand, is the state program. A lot of people think it's only for very low-income individuals, but the financial eligibility rules for long-term care are actually much more flexible than you might think. Medi-Cal is really the true gateway to ongoing custodial care.
And once your parent is approved for Medi-Cal, doors really start to open. First up is In-Home Supportive Services, or ISSS. This actually pays for home caregivers, and here is a huge financial and emotional lifeline. In many cases, ISSS allows you, the adult child, to be hired and paid as your parent's caregiver. It's a total game changer. Then there's Community-Based Adult Services, or CBAS. Basically, this is adult daycare with nurses and meals. It gives you a safe place for them to go during the day so you can get some essential respite. Finally, keep an eye on the Assisted Living Waiver, or ALW. This helps pay for future facility care. Now, the wait lists for this are notoriously long, so the best advice is to learn about it and get on the list right now, even if you don't think you need it quite yet.
And that brings us to Zone 5, Support and Immediate Action. Preserving the caregiver, that's you.
I cannot reiterate this strongly enough. You cannot pour from an empty cup. Finding support for yourself is a strict requirement. It is not a luxury. But please, do not try to build a support network from scratch. Look at the organizations that are already out there just waiting to help you. The Alzheimer's Association has a 24/7 helpline for those moments when you just need to talk to someone who gets it. The Family Caregiver Alliance is a phenomenal California-based advocacy and service organization. And perhaps most importantly on a local level, look up your Area Agency on Aging, or AAA. Every single county in California has one. It is your absolute main hub for all senior services, everything from meal delivery to transport to local support groups.
Okay, take a breath. I know we've covered an overwhelming amount of information today, so let's distill it down. If you're going to take a screenshot of just one slide, make it this one right here. Here are 4 concrete tasks for you to do this week. Number 1, schedule a family meeting. Literally pick a date and put it on the calendar. Number 2, find or create the Advanced Healthcare Directive and Power of Attorney. Get those signed while capacity exists. Number 3, do a quick 15-minute home safety check. Just go roll up those throw rugs and lock up the meds. And number 4, find the phone number for your local Area Agency on Aging and stick it right on the fridge.
A dementia diagnosis feels like an ending. I know it does, but as our source material beautifully states, it is also a beginning. It's the start of a new chapter that is going to require immense patience and a whole lot of compassion. Yes, the California system is a complex maze, but as we've seen, it is entirely navigable if you just take these structured first steps today. You might be sitting at that kitchen table, but you are not alone. There are thousands of families, state agencies, and community groups on this exact same journey right alongside you.
So take that first step, make that first call. You can absolutely do this. But all this planning also leads us to a very real, very tough question for the future. Sometimes, despite all the planning and all the home modifications, what happens when home is just no longer the safest option? That is a profound transition for any family, and it's exactly what we're going to be exploring in our next explainer. Until then, stay focused, stay empowered, and we'll see you next time.